Yeah, I mean, I think you have to find the common cause, which for these groups, at least in my experience, is always the patient. So in the end, everyone has their own piece of this puzzle, but in the reality, we're all trying to best serve the patient. And so the people who have gone into this profession, this very noble thing, in the end, we're trying to make the lives better for the people who seek our care. And so that's always the common denominator we try to start with, and then reverse engineer the best interest of that person. And I found great alignment within healthcare around that, common theme. So again, you just distill it all the way down, and hey, how can we best serve the next person who walks through the door, and how can we do that together? And it's funny, people become far less competitive and they tend to swim together in that interest.
And are there certain areas where that's been more challenging, certain conditions or populations where that becomes more challenging to get everybody aligned around those, or even certain areas where they weren't aligned and there were things that you did to really kind of shift that mindset?
Yeah, I mean, it's interesting. Like, healthcare has generations, like physicians who are at one point in their career, talk about physicians maybe who are over 50, there was one way of practicing care, whereas physicians who are now coming out, who are in their late 20s or early 30s, have a very different mindset. And so I would argue some of the more senior physicians were used to being responsible for everything. And so it was this ownership mentality. And frankly, a lot of burden rested on that individual to make sure they were serving the patient. I would say now there's more of a team-based concept. There's so much subspecialization within healthcare now. Really good physicians coming out of school now basically know how to utilize those resources, particularly primary care physicians, and things like physical therapy, physiatry, things that frankly didn't exist, 10 years ago, now have really come to the fore. And newer physicians use them very aggressively to make sure that their patients are treated in the most conservative way possible. For the rest of the physicians, it's more of an education effort to know that we can support their practice and the patients that they're responsible for.
Yeah,
so it's fascinating. Like, if you've met one physician, you've met one physician. And so that's the challenge. You've got to find a way to connect with them and help them understand how you can serve the people that they're responsible for. And they take that responsibility very seriously. So you want to make sure that you're building confidence within them and their practice.
Yeah, and it sounds like too how important that is to, relieve in a way that burden that, hey, this isn't all on you, and that all, I think that, I mean, my takeaway from that too is that, that also brings down some of the walls, so they're maybe not as defensive, right? Like, hey, this isn't all on you. We're all in this together, and where can we delegate or help offload you?
It is exactly right. Like, and great primary care physicians now are basically air traffic control for their patients, because the healthcare ecosystem is super complicated. And you have subspecialization, you have diabetes centers, you have wound care centers, you have people who do this work all day, every day, and can do a lot to support that patient and frankly, that physician and their practice, to your point. But you've got to go in there and you have to build trust, and you have to make sure that you're over-serving those patients so that when they come back to their physician, they are better and they've had a great experience. And so we're part of that paradigm, frankly. We're a support mechanism of the great work that, these physicians are doing.